a full-featured treatment planning software for guided surgery. One of the items that makes Blue Sky Plan unique, besides the fact that it is free for dentists to use, is that any lab can completely design a surgical guide in Blue Sky Plan with no other software and export it as an STL file ready for printing. A low per-case fee, starting at $11 per case, allows a lab to control 100% of the process and to offer computer-guided products and services to their dentists. Surgical guides can be prepared for all guided surgical kits and all dental implant systems. I'd like to thank David Long for joining us today and presenting today's webinar. David is the founder and owner of Right Choice Milling Center. He has collaborated in the planning and restoration of thousands of dental implants using 3D printed surgical guides. David is going to be presenting and discussing his lab's guided surgical process flow of a few guided clinical cases. David?
Yes. We're going to go over today a Blue Sky Plan surgical guide using a fully digital protocol. We're going to scan the patient with a Trios intraoral scanner, convert that into Blue Sky, and using the patient CBCT and plan a surgical guide. I'm going to start by going through a couple of pictures here. This is our end product. It's a fully 3D printed surgical guide in 3D model. There's no impressions with this technique. Everything is digital. We're using the Trios intraoral scanner and exporting that into Blue Sky. This is what our 3D scan looks like intraorally, so there's no impressions. This is the patient's area before implant placement. This is an Object 30 Orthodesk 3D printer that we use here in the office. And this is a surgical guide in place. We're going to back up and do the plan so we can show you how this works. So we have the patient's CBCT is already brought into Blue Sky, and pardon all the scatter radiation there. Some of these are, if a patient has a lot of PFMs, these can be tricky sometimes. And we have the model that we superimposed over the CBCT to do our plan. After I get this lined up, I usually go ahead and hide the rendering so you can see how this is lined up over the teeth, so we get a perfect guide. And I'll go ahead and usually turn this rendering off so I can just see the model. There we go. So our region of interest is tooth number, what is that, 5? Tooth number 5 there. We're going to virtually place the implant. We have selected a 3.5 by 13 in this area using Blue Sky Plan, and we will virtually place a tooth in that area to help us line up the abutment and the implant. These are all really, really nice features that Blue Sky has. I don't think a lot of companies have this. And we use that virtually placed tooth so we can get a more ideal implant placement. And from that, I will go ahead and place a virtual abutment so I can check our angulation and see if that's going to be a good restorative case. You don't want to have an implant that may be in good bone, but then you can't get a good restorative outcome. So that's where Blue Sky really excels in this, is having the ability to see how it's going to look before you ever place the implant. This is a really, really nice feature. So now we got our implant where we want it, and everything looks good. We're going to start the guide process. We will place our guide tube, and with this particular technique that I'm using, we're going to use a Blue Sky Nobel Master Tube compatible. It's a 5.01, I do believe. and we're going to use keyed surgery. You can do a one drill technique with the direct cut drills, which is also a really good option, especially if you have limited mesial-distal space between the teeth. Sometimes you can't fit a master tube in that space, so we would use just a one drill technique. But with this one, we have the room, so we're going to use a I'm going to change my parameters for the Nobel master tube. 6.6. To get the right diameter. Now what this is going to do is print this so that the metal guide tube will fit inside the surgical guide. And the standard offset for a flat ring is a 10 millimeter offset. But we're using Blue Sky rings, which I like the metal ring lip that's on there, which are 1 millimeter tall. So on a one drill technique, the offset is at 9 millimeters. But since we're going to use a tube inside of a tube, we would change that to 8 millimeters to allow room for the tube within a tube. This is probably the most complex part of making a surgical guide, is the offset. There are a lot of different drills and surgical kits out there. A lot of dentists use all different kinds of kits, and it can be very difficult to make a guide with some of the kits. It can be done, but it takes a little bit of forethought. I'm really a big fan of the direct cut drills and the printed drill stops from Blue Sky. It's all matched, so everything works together. You can use other kits. I do a lot of guides for doctors with other kits. Just takes a little bit of math to get the proper offset, so your drill depth is correct. So after we've selected the tube here, and we've locked our implant in so it can't move, and we're happy with the plan, the doctors approve the plan. Always have to have doctor approval that they like the position of the implant and the selected implant. We could have gone with a longer implant in this place, but this is fine for this one. Now we're going to go ahead and fabricate the guide. I have the proper ring, the proper offset, implants locked. I would save the project here. Go to Save Project and save that so nothing can change from this point. And after that is saved, now we're going to fabricate the surgical guide. So we go into the guide panel, and we're going to make sure our implants are locked. Use automatic brush. I use very high. My computer is really fast. On some computers you may have to use just high or normal, but with my computer I can use very high. And this is a maxilla, and we want to remove the undercuts. This is a very simple process once you have your plan. Now what we're going to do is draw our curve. We select draw curve, and you have to hold down the shift key to draw the line. And all this is just drawing your surgical guide around the teeth that you want. And you can make these as small as you want or as large as you want. What you want is stability. At least one full tooth, half a tooth, 1.5 on each side, just so you can get a really nice fitting surgical guide. But of course, if you keep them small, it's going to save money on the printing. And so now we can edit our curve. Just move the little dots around till you get it to look the way you want. And I generally, when I go over a tooth, I don't like to go in the interproximal. It tends to cause it to error. You want to go over the incisal edge in the middle of a tooth, somewhere along there. Especially these little lines here. Now you get them like that, and it doesn't glitch near as much. It makes for a better print. So now that we've got our outline for our surgical guide, very simple process, and we've got our flat brush selected. I use 15 millimeters. I like a big circle. I use very high We're going to fabricate this on the model. We've got remove undercut selected, flat brush, lock the implant, so it's just hit the button. And this will take just a minute. Now you can speed this process up by choosing a lower guide quality, but I'm really happy with the way they come out on very high, so I just use that. And there's our guide. Now from here, we can eliminate the things that we don't need. And this is why it was important to save your plan before you make the guide, because now we're going to delete the things we don't need, and that plan that you saved earlier will never change. So we'll go through the surfaces. They're color coded, so it's pretty simple. We no longer need the model. Get rid of that. No longer need the implant. No longer need the tooth. And now we have just a guide that you can see and inspect. And it looks really nice. I'm not seeing any anomalies, nothing odd in there, which is great. This is a very good software for making surgical guides. Some of the other systems that I've used, they didn't come out this nice. These are really nice. So the last step I would do on this is go ahead and put the patient's name on it. And you just move the guide around, and you can make the guide smaller or bigger. This is what will control your printed name. I'll put it close to the incisal edge because we're going to do some trimming and post printing to make sure this fits. So you would hit apply label, and there we go. The patient's name is now on the surgical guide, because if you're like me in a lab and you set something down, you can't remember who it belongs to. And that looks really good. And from here you would just export it. Export data. Of course, I'm out of STL exports, so I can't export this right now. But also, again, we'll pick very high, and this would export into a folder or onto a flash drive to carry to my printer. I usually keep a folder full of surgical guides on my desktop, and then I can just put them in a flash drive. So from there, we would take this surgical guide that we created to the 3D printer. Great thing about 3D printers, they're all, every one I've dealt with, they're open architect. As long as it's an STL, it will print it. There's nothing that you have to do special with a 3D printer. So Blue Sky exports it in STL, the model's exported in STL. All you have to do is put it in there and load it on a tray, hit the button, and it'll print. And what we get from there is the surgical guide here with the Nobel Master tubes in place. It fits beautifully. This digital protocol with the intraoral scanner, everything just absolutely fits beautiful. This is the printed 3D drill stop. That's also from Blue Sky. And we're using a key, so we're using a tube within a tube. Just the doctor just prefers to do it this way. That way we can use maybe 2 drills on this one, but in limited space, you can, or in softer bone, the direct cut 1 drill technique also just works beautifully. We're using direct cut drills with the printed drill stop. I colored it here so it'd be easier to see. We're using a guide tube. Like I said, we'll use 2 drills. We used a 2.8 with a guide key, and then finished with a 3.2 final drill. I think it was a 3.
Final drills are 2.6 and 3.5.
3.5.
For the
for the 3.5 implant. So yeah, we used 2 drills total. There's a second drill. Then we place the implant. This is the benefit that I like with the Nobel Master Tube that we get from Blue Sky. You can place the implant, this particular brand of implant with the carrier, directly through the guide. That way you get to visualize that it's going in straight by paralleling against the walls. This is a little added benefit to get a perfectly placed implant, because sometimes if you take the guide out and place the implant by itself, you can get some deflection. Implants tend to want to walk and go the direction they want to go. If you place them through the guide, it's always perfect. And you can see it stops at the top of the ring, at the top of the carrier. We know the implant is fully in. It's got torque. It's been placed perfectly to the plan. And then there's the healing cap. And like I said, this was all done with no study models, no impressions, all done digitally. And it's I think this implant total took about 7 minutes to place the implant. And this is another one, same thing. It's a second molar, which can be more tricky. Same thing. We scanned the patient, printed the model, planned the surgical guide, printed the model and the surgical guide at the same time. You can see how nicely these fit. There's no stone to pour up, no impression materials. And there it is in place. Very difficult case, limited vertical dimension, but we were able to get in there. And using a master tube, same thing, same protocol. Using Blue Sky's master tubes and a key. That way we could step up, because this was very dense bone. So we had to use, I think, 3 drills on this one. And that's it. This is our scanner that we use. And I'm sorry that was short, but this is very simple, so it goes pretty quickly. There's not a lot to talk about. So if you have any questions, I'm open to questions.
Yeah, let me read off some questions. How accurate do you find the guides to be?
They're extremely accurate. I couldn't imagine ever doing a surgery without one, especially with the trios and Blue Sky, and using the ring within a ring technique. It's as close to perfect as it can possibly be right now. The only element that I could think of changing to make it any more perfect would be to eliminate the doctor and use a robot to place the implants. That would be about, and I haven't built the robot yet, so. But yes, they're extremely accurate, and they fit just very little post printing, finishing of the surgical guides. Everything works. It works really well.
Have you prepared guides for all-on-4 cases?
Yes, that's mainly what we do in our office. We do about 2 a week. It's basically the same protocol, but instead of an intraoral scan of a single tooth, where it's a tooth-borne surgical guide, you're going to use a scan appliance, which is just their denture, or we prefer to start with a new denture, at least a wax-up of a denture, to get the teeth where we want them in the all-on-4. You need really good flanges with some thickness to them. What we'll do is we'll do a wax try-in of ideal tooth placement. I'll duplicate that wax try-in out of acrylic like jet, and we will scan the patient with that jet with barium markers in place, and then I'll scan the scan appliance with the CT machine by itself, merge the two together in Blue Sky, and do the exact same protocol. They work phenomenal. The key to all-on-4 is that the scan appliance must fit the mouth very stable. Whatever you're going to use for a scan appliance in the all-on-4, if it's their denture or if you're going to do a new setup, it has to fit perfectly in the mouth, because however it fits in the mouth is how the surgical guide's going to fit. And if you get a good fit in your scan appliance, it's exact same protocol. You can use the one drill technique, or you can use a tube within a tube, and it works very nice. Yeah, we actually did an all-on-4 surgery the other day. All 4 implants placed with a Blue Sky all-on-4 plan and angle correcting abutments in about 13 minutes on an all-on-4 case.
If there are additional questions, please enter them into the Q&A box on the right side of your screen. Also, please enter your details into the webinar attendance form. The link could be seen below the video. Um, oh, here's a question. What are the costs involved in preparing a guide, and what are the range of prices you're able to charge the dentist?
Well, I'm very inexpensive. I don't really do the guides for money per se. I do it to help doctors. I only charge $99 for the plan and the guide. I know that's probably ridiculously low. Uh, the cost to fabricate a guide, it's according to whether you're going to buy the 3D printer yourself or you're going to pay someone else to print the guide for you. But most people will charge you about $30, $40 to print the guide and the model, and the rings from Blue Sky are like $5 a piece. So it's very feasible to make a guide for $50 to $60, even if you outsource the printing. And the average price for a surgical guide that most labs charge is $250 to $350. So no 5-time markup is normal. And the surgical guides. Like I said, I charge really cheap because I don't really do it for the money. So don't judge me.
Do you always remove the undercuts when fabricating a surgical guide?
Not always. Sometimes just a particular shape of people's teeth, especially if they have other crown and bridge work around it, which on implants they can be kind of bulbous and have really large undercuts. And if your model's small, if you try to remove the undercuts, it will take away too much and you won't have enough guide there, if that makes any sense. It's just the way that machines see in straight lines. So you can choose not to remove the undercuts and just trim down your guide manually with a handpiece. I do more with a handpiece than I do in the computer because I don't want to take a chance on overdoing something in the computer and then I have to start over again. So yeah, you don't have to remove the undercuts. You can do it by hand. Also, with the fit of the guides, some people, they'll have little gaps between your teeth. A 3D printer is going to print those interproximal areas, so you may have to take a burr and go in and knock these little edges out. But in general, it doesn't take more than maybe 5-10 minutes to finish a guide, put the ring in it, then it's ready to go. You can't put them in an autoclave, so I cold sterilize and then I'll put them in a UV sterilizer and they're ready to go. Around here sometimes I'm running behind and the patient might be in a chair and I'll run in there and finish their guide, while the doctor's getting them seated. It's not much work to it at all.
Okay, I'm curious. What's the turnaround time from the time that you decide that a patient needs a surgical guide until the surgical guide's actually ready?
It takes me about 10 minutes to plan an implant and design the surgical guide. The 3D printer on a single guide, if you're running one by itself in a pinch, my printer will print one of these small quadrant ones in about 2.5 hours. Of course, you don't want to do that. You want to load in like 10 at a time and let them run at night while you're at home. But we've got a couple of patients right now from out of town, so they came in today, they're scanned today, they want their implant tomorrow. So, I'll I can run 2 or 3 in a day pretty simply from start to finish. It's very little labor involved in these. I wish 3D printers were even faster. Yeah. But just to make things easier to plan out in the lab, I give a general 5 to 10 day turnaround. But actually making them, it's very simple. One person can turn over if they're going to do the plans. If you're going to do the plans yourself, a person can easily do 10 or 15 or 20 of these a day. If the doctor's going to plan them, of course, then it makes it much easier on you. It's simply just designing the guide over their plan, so it's very simple. Printers, they're all different kinds of printers out there. Most of them take on a guide like this a couple hours to print, but no, you're going to load an entire tray at one time, maybe 20 guides, and it'll print them overnight and they'll be ready for you in the morning.
Okay. If there are any other questions, please enter them into the Q&A box. We're actually going to be releasing a new build of Blue Sky Plan sometime this week that includes a parts panel. So that will display for the treatment plan that's planned which drills, implants, metal cylinders, and drill stops are relevant for the case. And they could be ordered. There's an order now button that will enable everything to be ordered very quickly and simply and take out a lot of the calculations necessary in terms of determining the proper metal surgical tube for the surgical guide. So that's something that we're currently working on, and we'll have live in the next few days, actually.
Yeah.
Okay, I think that pretty much wraps things up. If there are additional questions, they could be sent. You could check out Right Choice's website. What's the URL for Right Choice?
RCML.
It's www.rcmil.com. Just go to the contact page, and anyone that has any questions, they can send me an email or call me on the phone, and I'll be glad to help them get this set up.
And if anybody has questions directed towards Blue Sky Bio, you could send them to PLAN, at blueskybio.com, or contact me directly via phone, 312-423-6529, and we'd be happy to help. I'd like to thank you, David, for the webinar presentation, for taking the time to putting it together.
You're welcome.
And thanks to everybody for joining us today, and hopefully this will be the start of something new in your own lab. Enjoy the rest of your day. Take care.
Thank you.